You know, it's truly remarkable how vulnerable some newborns are. We often just assume they pop out ready to face the world, biologically speaking. But for foals, these tiny, brand new bundles of energy, well, that's just not the case. Today on the Deep Dive, we're unraveling a really critical puzzle in animal health. Why are these beautiful creatures born almost completely defenseless, without the basic immunity they need to survive those first crucial days and weeks? We're diving deep into something called failure of passive immunity, or FTPI.
It is remarkable, and it's a kind of profound evolutionary gamble, really unique to mares and their foals. The heart of the problem, it lies in their placenta. Mares have what's called a diffuse epitheliochorial placentation. Basically, think of it like a very, very tight biological barrier.
Okay, tight how?
Well, unlike in humans or even, say, cattle, those absolutely crucial large antibody molecules, immunoglobulins, they just physically cannot cross that placental barrier from the mare to the foal during pregnancy.
Ah, so nothing gets through beforehand.
Exactly. So foals are born with their own immune system, sort of ready to go, ready to be activated, but they have almost no protective antibodies actually circulating in their blood at birth. Zero. Their initial humoral immunity, that's a part of the immune system using antibodies in the blood, kind of like their first liquid shield, it's entirely dependent on them absorbing these life-saving antibodies from the mare's colostrum, that first milk, right after they're born.
So they're not just starting from scratch. They're starting with, like, zero in the immunological bank account. And that very first meal is their only shot to open that account and get protected. That makes colostrum sound, I don't know, less like milk and more like liquid gold or a shield, doesn't it?
It really is absolutely critical.
Our mission, then, in this deep dive, is to really get our heads around what FTPI means, why this silent threat is surprisingly common, how we diagnose it when the clock is ticking, and most importantly, what vital steps can actually be taken to protect these incredibly vulnerable newborns. We've pulled from comprehensive veterinary sources to, hopefully, equip you with this crucial knowledge. We've just touched on this remarkable biological setup, but for listeners who might be new to this, how do we actually define FTPI clinically? What exactly are we talking about when we say failure, and how do we measure that vulnerability?
Yeah, good question. Officially, FTPI is defined as inadequate passive immunity in these neonates, and we see that as abnormally low concentrations of immunoglobulins in their serum, their blood, when they're older than about 18 hours.
Okay, so there are specific numbers.
Yes. To give you some context, normal, healthy foals that get enough high-quality colostrum and absorb it properly, they should have serum IgG, that's a key antibody type, greater than 1,500 milligrams per deciliter. Think of 1,500 milligrams per deciliter. Think of 1,500 milligrams per deciliter. Think of 1,500 milligrams per deciliter. Like the green light that foals will protect it.
Got it. Green light.
But if those IgG levels dip below 800 milligdl, that's a red flag. That indicates FTPI, partial FTPI usually. And if it's really low, say below 400 milligdl, that's complete FTPI. Essentially, no protective shield at all. Leaves them incredibly vulnerable.
Wow.
And what's fascinating here, or maybe worrying, is that without that initial boost from colostrum, a foal's own naturally produced antibodies don't even reach protective adult-like levels until they're around 4 months old.
4 months. That is a huge critical window of vulnerability they're facing without that early protection. So, if these life-saving antibodies are all packed into the colostrum, how does this tiny foal, just hours old, actually get them from its gut into its bloodstream? What's that incredible process like?
The mare herself is amazing. She concentrates these immunoglobulins in her udder during the final maybe 2 weeks of gestation. She's essentially stockpiling the defenses. Then, after birth, specialized cells lining the foal's small intestine epithelial cells, they have this unique ability to literally, drink up these large antibody molecules. The process is called pinocytosis.
Pinocytosis, like tiny cellular straws.
Kind of, yeah, sucking up these vital proteins and passing them directly into the foal's lymphatic system and then the blood. But here's where the race against time really kicks in. These specialized cells. They're very quickly replaced by more mature, non-specialized cells.
Oh, so the window closes.
It does, rapidly.
Mm-hmm.
The window for maximum absorption happens right after birth, and then the efficiency decreases significantly by 12 hours. By 24 hours, it's pretty much completely gone. That's what we call gut closure.
Gut closure, okay.
And just to put it in perspective, a typical 45-kilogram foal, about 100 pounds, needs to ingest over 1.5 liters of good quality colostrum just to have a reasonable shot at hitting that serum IgG level above 800 milligdl.
1.5 liters. That sounds like a lot for a newborn. So it's not just about getting colostrum, it's about getting enough of it, and incredibly fast. If a foal misses that initial vital boost, What are the real-world consequences? Just how common is this hidden vulnerability, this FTPI?
It's actually more common than many people might realize. Reports indicate FTPI can occur in anywhere from 3% up to maybe 24% of otherwise normal thoroughbreds, standardbreds, Arabians in major breeding areas like the US, UK, Australia.
Wow, up to a quarter in
Yeah,
seemingly healthy foals.
exactly. Up to a quarter born without their fundamental shield. And get
Hmm.
this. For foals that are already struggling, maybe they're in a veterinary hospital, a significant 61% in one recent study were found to have FTPI.
61%. That's staggering.
It really is. And this isn't just a number, it's a silent, pervasive threat. It puts the foal at severe risk of systemic illnesses, most commonly bacterial infections. We often see these infections settle in the lungs as pneumonia, or in the gut causing severe diarrhea, or sometimes in the joints leading to septic arthritis. You might hear it called joint ill.
Hmm.
And sepsis, a widespread systemic bacterial infection, that's a leading cause of mortality in these young foals.
That 61% in hospitalized foals really drives home how foundational this early immune transfer is. Given that there are no clinical signs of FTPI itself, I mean, it's a measure of immune strength, not a disease state on its own. What are the main reasons a foal might end up with it? What are the underlying causes and risk factors?
Yeah, that's key. The causes generally fall into three critical buckets. One, insufficient volume of colostrum ingested. Two, loss of colostrum before the foal can drink it. Or three, the colostrum itself just doesn't contain enough immunoglobulins. It's poor quality.
Okay, break those down a bit. Loss of colostrum.
So, for example, if a mare lactates prematurely, people often call it running milk or waxing early, she can lose that precious concentrated colostrum before the foal is even born. It just drips away.
Ah, okay, and the quality.
The quality is paramount. We can measure it. If it has a specific gravity below 1.060, or, using a more common tool now, a Brix refractometer reading below 23%, it's generally considered poor quality. Essentially, it's too watery, doesn't pack enough antibody punch. And that significantly increases the risk of FTPI, even if the foal drinks plenty.
Right. And what about the foal side of the equation? They actually have to do the drinking, right?
Absolutely. If a foal fails to stand and nurse vigorously by, say, 3 to 6 hours after birth, they're already at high risk for partial or complete FTPI. If they haven't nursed properly by 12 hours, they usually have complete FTPI because that critical absorption window is closing fast, as we said.
So any weakness in the foal is a major risk.
Definitely. Foals that are weak, maybe slow to stand, premature, or just generally unable to nurse effectively are at a huge disadvantage. Beyond that, certain things about the mare increase the likelihood, too. Mares over 15 years old, they might simply not produce as much colostrum, or it might not be as potent. And there's this specific issue with endophyte-infected tall fescue pasture. It contains a fungus that actually interferes with the mare's hormone production, directly shutting down milk and colostrum synthesis. It's a really insidious problem in some areas.
Wow, a plant fungus.
Yeah. Even environmental factors seem to play a role, like foals born in cold, overcast climates have shown a higher incidence compared to those born in sunnier climates. Probably just the added stress on the newborn. And of course, premature foals or those from unusually long gestations are also at higher risk, as is any foal that's generally weak or just seems poorly adapted to life outside the womb.
Okay, so a lot of potential pitfalls. Given how critical time is, how do we diagnose FTPI quickly? We can't wait for a foal to get sick to find out if they're protected. We need to know before that happens,
Yeah,
right?
exactly. Timely diagnosis is absolutely critical because that window for effective oral treatment, giving more colostrum, closes so rapidly. Now, a complete blood count, a CBC, can tell us if there's systemic disease brewing, but it's not a great direct screening test for FTPI itself.
So what is the best approach?
The ideal time to test a full serum IgG is between 12 and 24 hours of age. Testing right around 12 hours is actually excellent because it allows you to identify FTPI before that gut closure really happens, so you still have the option to intervene orally with more colostrum.
Ah, smart. Catch it early.
Right. But the 18 to 24-hour mark typically gives the most definitive assessment because by then, maximal absorption should have occurred. After 24 hours, remember the gut is effectively closed to absorbing these large IgG molecules, making oral supplementation for immunity pretty much useless at that point.
Okay, 12 to 24 hours. So what are the most practical and reliable ways for someone, say, on the farm, to test quickly within that window?
Well, the absolute gold standard for accuracy is a test called the Single Radial Immunodiffusion Test, or SRI. But the downside is it takes up to 24 hours to get results.
Too slow for making quick decisions.
Exactly. Impractical for those crucial on-farm decisions. This is where the full-site tests really shine. ELISA-based kits, like the SecSite Full IgG Test Kit or the SNAP Full IG Test, they're excellent. They are rapid, give results in just minutes.
Minutes.
Okay, that's useful.
Yeah, they can often be performed right there on the farm using serum, plasma, or sometimes even whole blood. And they provide semi-quantitative results, meaning you get a good idea of the range, like, is it below 400, between
Well,
400 and 800, or above 800?
gives you actionable categories.
Precisely. Other tests, like the zinc sulfate turbidity test or the glutaraldehyde clot test, are decent screening tools because they're quite sensitive, meaning they're good at picking up. If there is a potential problem, they don't miss many cases. However, there's a latex agglutination test, sometimes called Foal check, that's generally not recommended anymore. It tends to have lower sensitivity and specificity, meaning it might miss some cases of FTPI or sometimes give false positives.
Okay, so SNP or C-ITE tests are probably the go-to for fast, reliable results on the farm. Once FTPI is diagnosed, let's say you get a low reading on one of those tests, what's the immediate course of action? The goal is to raise those serum IgG concentrations, right? To basically get that shield up. Precisely. The aim is to get that serum IgG level up to at least 800 milligdl, especially critical if the foal seems at risk of sepsis or other infections. Now, for foals that are still very young, typically less than 12, maybe up to 18 hours old, and are otherwise clinically healthy, oral administration of colostrum is the preferred treatment.
But it has to be good quality colostrum.
Absolutely. You need colostrum with that specific gravity greater than 1.060 or the Brix reading of at least 23%. High quality, concentrated stuff. Usually administering 1 to 2 liters in total, but given in multiple small feedings, say 200 to 500 milliliters every 1 to 2 hours, either via bottle or sometimes a nasogastric tube, is ideal to ensure absorption without overwhelming them.
Okay. And what about using cow colostrum? Sometimes you hear about that.
Yeah, bovine colostrum products exist, but they're generally not recommended. While they might provide some local gut protection, they result in less than optimal passive immunity specific to horses. The antibodies aren't quite the right fit, so it's simply not as effective for systemic protection in a foal. Always use equine colostrum if possible.
Got it. Equine specific is best. What if that critical 12 to 18-hour window for oral absorption is passed? Or what if the foal is already showing signs of illness? Maybe seems a bit dull or has a developing infection.
Right. In those critical cases where adequate oral absorption for optimal IgG levels is unlikely, or if the foal is already sick, then intravenous administration of equine serum or plasma becomes the definitive, often life-saving treatment.
Giving the antibodies directly into the blood.
Exactly. Commercial frozen equine plasma is generally preferred because it's tested and readily available. Though fresh plasma can also be harvested from the foal's own dam or another suitable healthy donor horse on site, if necessary. Dosage-wise, for a typical 45-kilogram foal with really low IgG, say less than 400 milligdl, they usually require about 2 liters of plasma. That works out to about 40 millimoles per kilogram of body weight. If their IgG is in that intermediate range, between 400 and 800 mg/dl, they'll usually need about 1 liter, which is roughly 20 milliliters per kilogram. It's really crucial to administer this plasma through a special inline filter to catch any tiny clots or debris, and you have to thaw frozen plasma slowly, usually in a warm water bath around 39 to 45 degrees Celsius, and then warm it gently to at least body temperature or close to it, maybe 20 degrees Celsius minimum, before giving it.
Can't just microwave it, I guess.
Definitely not. That would destroy the antibodies. And the initial infusion should be slow, maybe over the first 15-30 minutes, while monitoring the foal really closely for any adverse reactions like increased heart rate, breathing difficulty, agitation. Once you see it's being tolerated well, the rate can usually be increased.
And after you've given the transfusion, do you retest the IgG levels to make sure it work, to see if you actually got that shield up?
Yes, absolutely. Measuring the serum IgG again after the transfusion is complete, sometimes as soon as 30 to 90 minutes post-transfusion, is really important to confirm that you've achieved adequate IgG concentrations, that you hit your target of over 800, and this is vital. For foals that are already sick, battling sepsis, they might actually use up those administered antibodies much faster. the half-life of the IgG can be reduced. So they might potentially need multiple transfusions over days to maintain those protective levels while their body fights the infection.
Wow, okay, so it's not always a one-and-done treatment for sick foals.
Hmm.
This really makes it clear that prevention truly is the best medicine here, especially when the stakes are this high, life and death, really.
Hmm.
What proactive steps can owners or breeders take to try and avoid FTPI altogether and just give these foals the best possible start?
Prevention is absolutely paramount, you're right. And it really starts with proactive, vigilant management of both the mare and the foal right around the time of birth. For the mare, making sure she's appropriately vaccinated against common pathogens, usually about 4 to 6 weeks before her due date, helps maximize the antibody levels in her colostrum. Good nutrition and general health throughout her pregnancy are also vital, of course.
Makes sense. Build up her reserves.
Exactly. And then close observation for any premature lactation, that running milk we talked about, is key. If significant amounts of milk are lost before foaling, you should try to collect it if it seems like good quality colostrum and freeze it, or at least be ready with an alternative colostrum source immediately after birth. And importantly, assessing the mare's colostrum quality right after foaling, before the foal nurses extensively, using a Brix refractometer.
Oh.
That's highly recommended now.
Testing the milk itself.
Yes. If it's poor quality reading below that 23% mark, seems too thin, right away that foal needs supplementation, even if it nurses well. Don't wait for the blood test 12 hours later. Maintaining a frozen colostrum bank collected from other healthy mares on the farm with high-quality colostrum is also an excellent proactive strategy for any breeding operation, just having it on hand.
Good insurance policy. And for the foal itself, what specific action should be taken in those critical first few hours?
For the foal, encouraging prompt nursing, ideally within 1 to 2 hours of birth, is absolutely critical. If they're having trouble finding the udder or latching on, assist them. Don't just wait and see. You need to ensure they're having vigorous, sustained suckling efforts, and also check that the mare's udder is actually softening, which indicates milk is being removed effectively.
So making sure they're actually getting it.
Right. Maintaining a clean and disinfected foaling environment is also important to minimize the foal's exposure to harmful bacteria right from the start. And proper umbilical care, dipping the umbilical stump promptly and repeatedly with a suitable antiseptic solution, like dilute chlorhexidine, helps prevent infection getting in through that open pathway. But perhaps the single most important preventive step on the foal side, beyond ensuring that initial colostrum intake, is doing that routine IgG testing between 12 to 24 hours of age in all foals, especially those considered high risk, but really, ideally, all of them.
Test every foal, basically.
That's the ideal, yes. This proactive step allows for timely intervention if FTPI is detected, before serious illness has a chance to take hold. It truly is about winning that race against the clock.
This deep dive has really shown us that failure of passive immunity in neonatal foals isn't just, a common thing. It's a really serious condition, directly linked to increased sickness, morbidity, and mortality from infectious diseases. It all stems from that unique placental structure in mares, the epitheliochorial type, which means foals are born completely dependent on absorbing those vital antibodies from colostrum immediately after birth.
That's the crux of it. They have no fallback.
And the critical window for this absorption and also for testing those vital IgG levels is incredibly narrow. Really just 12 to 24 hours after birth. It's truly a race against time from the moment they hit the ground.
It is, and if FTPI is identified, the treatment path is pretty clear. Oral supplementation with high-quality colostrum or maybe a commercial replacer if the foal is young, healthy, and critically, before that gut closure happens. After gut closure, or certainly if the foal is already showing signs of illness, then intravenous plasma transfusion is the definitive and often life-saving treatment. But as we've really hammered home, prevention through proactive, careful mare and foal management right around the time of birth is always, always paramount. Understanding these precise biological mechanisms, it really empowers us, It empowers us to intervene and safeguard life during this incredibly vulnerable window. This whole topic, it really does highlight how a small, critical window of biological development, in this case, just the first 24 hours of a foal's life, can have such profound, far-reaching consequences for survival and health. It kind of raises an interesting question, maybe something for you to consider. What other critical windows of development, maybe in any species, might we be overlooking, where perhaps a subtle biological mechanism or a brief period of vulnerability holds a hidden key to long-term health and survival?
That is a truly thought-provoking question, and a powerful reminder of how much we can learn from really digging into the intricacies of life, like we did today. Thank you for joining us on this deep dive into equine neonatal immunity and that critical race against time. Keep exploring, keep questioning, and keep gaining knowledge.